Some say the children are our future. Teach them well and let them lead the way. But in order to do that, they got to be prepared to come into this world. Can you say doula? What's going on? What's going on, everybody? Welcome to the Risky Lifestyle Podcast. And yes, I am your host, Joshua Southern. Or you can call me Big Risky, Big Cuz, Big Josh, Big Smooth, whatever you want to call me. But I have a very special guest today. I call her Doctor. And you're going to know why as we walk through this episode of the Risky Lifestyle Podcast. And I'm going to introduce my guest, Dr. Sharde Burton, everyone. How you doing today?
I'm good. Speaking into existence. How you doing?
I'm doing fantastic. I'm glad you were able to stop out of your busy schedule because I know you are a busy lady. That's why, you gave me some dates and, we was like, okay, this is a good date and let's knock it out. So, let's just start off. There's a few segments, which I think I sent you, didn't I? I didn't send them to you. Okay. Well, anyways, there's a few segments. There's a I remember when. There's a where are you now and where are you going? Those are the main segments. And then from there, we got a couple fun segments in between that. So.
Right.
So we're going to start off with I remember when, and then we're going to go into, just some quick introductions, who you are and what you do here in Lansing. So
Okay. Sounds good.
So yeah, I remember when I first met you. It was on a Sunday morning that I was just visiting the church. And I think I was on second shift at the time at GM, but I was a little tired. And you came in, you were quiet as usual, quiet as a church mouse, as they say. We were actually at church, so
Yeah.
so I mean, it was fitting. But after service, how everybody talk, so I had a chance to meet you then. Didn't know that, you were this esteemed, personality in the Lansing community, and you take care of business and you stand on business. So, yeah, I mean, that's kind of like my quick, I remember when, but yours can be, you remember when you fell off your bike when you were 3 and, you scraped your knee. So,
All right. Well, I'll take it back to my childhood since you introduced me as doctor.
yeah.
I actually remember when, as a childhood, it was my dream to be a doctor. Like,
Yeah.
I used to play doctor all the time with my dolls, like my mom, anyone who would, be my pretend patient.
Absolutely.
And I just knew that would be what I would be when I would grow up. I just wanted to help people, and the
Yeah.
medical space was so fascinating to me. I used to watch those medical surgery shows on the TV, sit in front of the TV and eat my dinner watching those. And my mom was like, "How are you watching that and eating dinner?" Like they're in the middle doing all this surgery, pulling out organs and stuff. But I thought that was so fascinating.
What type of shows, though? What type of shows?
Like Operation, ER, all of I think they used to come on TLC and
TLC,
stuff.
yeah.
Yeah,
Oh,
all
yeah.
of those
I mean, those
would
are
be watching
those
all
are
the
great
time.
shows. I mean, I was more of a National Geographic type of guy.
Yeah.
Like to see nature, all the animals and all that stuff. Growing up. But yeah, so I believe in you. There's still plenty of time for you to go ahead and get that doctorate. But I mean, you did say something, right? Like you always wanted to help people, and I know. I mean, but we're gonna tell the people what you're doing. But you are helping people. You are giving people resources in the community and all that good stuff. So let's before we start to get there though, let's talk about just growing up. Where you from?
I am born and raised Lansing, Michigan.
Oh,
I know.
okay.
I I have been here my entire life.
Okay, okay.
But yeah, I born and raised Lansing, Michigan. My mom worked at Michigan State University,
Nice.
so it was kind of almost like I didn't really have. I mean, I've had other choices,
Yeah,
but
for
I mean,
sure,
it
for
of
sure.
course was a smart choice because tuition discount a little bit and stuff like
Yeah,
that. So,
absolutely.
and then yeah, I've just been here. Life has kept me here, and
Yeah,
obviously, I had a purpose that we'll get into of why I'm still here. So,
absolutely. I mean, so where did you go to high school and
I
everything
went to
here?
Waverly High School.
Waverly,
Yeah,
the Black and Gold. I think they're the Warriors, right?
they are the Warriors. Yep.
Yeah, I can appreciate Black and Gold. I mean, we are here at Risky Studios where,
Yep.
our business color are Black and Gold, but also my high
Absolutely.
school was Black and Gold. So,
Okay. Yep.
shout out to the Saginaw High Trojans, which this is their last year. They're gonna consolidate with our crosstown rival. So,
Oh wow.
we'll have a brand new school in the fall, and there'll be, I think, the Saginaw Phoenix or something like that. I
Okay.
can't. Well, Saginaw United Phoenix.
All right.
So, um, kind of excited.
Yeah.
It's something where you don't always get brand new schools put in your lap, right?
Right.
So,
Right.
but it was a need. I know enrollment and everything was down. So, but yeah. So yeah, let's just kind of like dive into you know, childhood, like, and what like made you, kind of take the path that you're like currently in now. Like, what are some of those things? I know you just talked about, wanting to be a doctor, wanting to help people, but like, when was it like where you was like, you know what, like this is something that I want to get into, like whether it was shoot college or anything like that. So
Yeah. Um, I think, it definitely can go back to my childhood. I had a close relationship with my grandparents. So seeing them kind of age and go through the medical system and just stuff that they had to deal with, it kind of sparked something in me
yeah,
because, you know, for some of the cases, they received the healthcare and treatment that they deserved and that they should have. But in some instances, I just knew, and a lot of times it came from being around adults in my family and hearing them
yeah.
talk a lot. But they were like, "Oh no, this doctor didn't do this right," or "I don't think
Oh
this was
yeah,
right." And so I saw from a very early age, but didn't really know what we now know as like disparities or um, odd treatment that Black people face in the healthcare system.
medical negligence.
Yes, all of
Yeah,
that.
yeah, yeah.
Yeah, I
Absolutely,
didn't, know what it was or what to call it at that
absolutely.
age, but
Yeah,
being around it, I knew it, and it was something that tugged at my heart, like, "Why? That's my grandparents," or, "Why are they,
no, that's good.
being treated like that?" Like, so
Absolutely. I mean, and you see it all the time. Even when I think about my wife's experience at one of the hospitals where my son was born in Detroit, and I won't say their name, but
mhm,
um, it was a difference from when my son was born in Detroit and my daughter was born here in Lansing. Like,
mhm.
and this hospital was supposed to be a premier hospital,
Yeah,
like where they had great facilities, resources, supposed to have like the best staff and everything. And when we visited, I mean, it was
mhm,
they were hyping it up like that, right?
yeah,
But um, when I say like it was very poor.
mhm,
Um,
yeah.
and I ended up getting sick there. I had food poisoning and
Oh,
everything.
man,
Yeah,
yeah,
yeah, yeah. So I do understand that, and like you hear those stories from a lot of Black women, who are in labor and
mhm,
delivering. They didn't
yeah,
get the proper treatment or like the proper care, even just a simple like, "Hey, are you okay? Are you in pain?"
yep,
It's just kind of like, "Oh yeah, whatever."
yeah, exactly.
They're good.
Yeah.
So I definitely understand that, and like so let's talk about, I guess, your educational background
Mhm.
too. Before we get into like
Yeah,
like where are you now, right?
yeah. Yeah, so in college, undergrad, I started out pre med. Again, as I said, I was like, oh, I'm just going to make it to med school. I'm going to definitely be a doctor in life. But decided to take another path. After I finished undergrad, took some time out, started working,
Yeah.
and then I found out about public health. So, public health is kind of like making a difference in the healthcare system, but you are looking at it at like the whole big picture level. You're
Absolutely.
looking at system
Absolutely.
changes that need
Mm,
to happen within the healthcare
that's
system
good.
versus doing that direct patient care clinical stuff. So I went back and got my master's in public health. Was a great decision. I loved all of my courses throughout that degree. Was passionate about it, excited to graduate and get out into the world and, see how I can make a difference at a bigger
Absolutely.
impact, or at a bigger scale.
Absolutely. And I believe you have your master's too, right?
Yep, and public health is my
Yeah,
master's,
yeah,
yep.
yeah. So I mean that, you know, like I said, guys, she's on her way to her doctorate, and she's gonna be called Dr. Burton, and we're gonna be proud of her once she does it. So, but yeah, so you went to Michigan State, got your degrees from there, and then from there you ventured off into what I want to call now. Where are you now? So where are you now
Yeah.
currently working in the public sector,
Yeah.
and doing some phenomenal things. Got some great things coming up I know of, but hey, let's just talk to the people. Let's talk to the people a little bit about what you got going on.
Yeah, so once I finished my master's in public health, I did start working full time in public health. So I am still doing that, kind of looking, as I mentioned, like at that population level, working to do systems changes within our healthcare systems, looking at the disparities that Black people face, making large changes that can hopefully, impact those and improve health outcomes for people of color. And so there was still something a part of me that was like, I still want to be at that patient clinical level. Like, I
Gotcha.
still want to be working directly with people. And so, the pandemic hit beginning of 2020 or so. Everyone stuck at home. We had a lot
Absolutely.
of time on our
A
hands,
lot of time.
there became opportunities to take doula trainings online. And that was something
Wow.
that I was passionate about because Black maternal health, as you know, Black women are 3 to 4 times more likely to die or have complications during
Absolutely.
birth than our white counterparts,
Absolutely.
and that is not acceptable. We should not be facing that here.
Why do you think that is though? Like is it a like systemic like racial thing, or is
Mhm.
it just like um lack of, I guess, study on Black people or Black women? Like, what do you think it is?
Absolutely, racism, I would say, is number one. I think a lot of times women's voices aren't heard, and you kind of even touched on that. Women's pain are kind of undervalued or not really taken as
Absolutely.
is when they say they're in pain. Historically, they used to teach in medical schools that Black people didn't feel pain or that they felt less pain
Mm,
than white
yeah,
people.
absolutely.
So a lot of that historical racism and system stuff, absolutely.
Yeah, and so like when you talk about working for the people, changing systems, like are we talking about on like more of a legislative front, or is it more so just like directly tied to like the healthcare, like hospital system?
Both kind of. Legislative change definitely, is powerful in many ways. When it does happen, we have now maternal health is a huge focus across the United States. We have
Absolutely.
legislation like the Momnibus Act and stuff like that, which is making doulas a priority,
Yeah,
making extended postpartum care for mothers a priority.
that's
So
huge.
legislation does absolutely does it as well, but it also needs to focus on the healthcare system too,
Absolutely.
because we need to look at, providers that are in these healthcare systems, leading them, and biases that they may have.
Yeah.
How do we address that in the system?
Absolutely. Absolutely. So like when I look at the healthcare system as a whole, I mean, it's something that just needs a huge overhaul, right?
Hmm. Yeah,
Along even I feel even with our like education system, but definitely like our healthcare system just need a whole overhaul on like how we really take care of the people. Because if people aren't well, how can they work? We see like even things where people aren't working. I
yeah,
mean, we have manpower issues all across the nation. Some of it is laziness, but I mean, I'm
yeah,
not gonna get into that. But like, some people are not well. Some people got um, what you call it, workers' comp cases,
hmm,
and they aren't getting the proper treatment.
yeah, for sure.
And we're just putting band aids on everything. And for me, I'm starting to even dive into more holistic things,
Yeah.
just to take care of my body and make sure and not pumping myself full of these different drugs because big pharma is real.
Yeah. Absolutely. Yeah,
And
absolutely.
they are here to make money, and some of this stuff just puts band-aids on things and cause other side effects. So but yeah, like, so let's get into this doula thing. Like, so my first question, how many babies have you delivered already?
Oh, wow. Well,
I mean, just just a quick
yeah,
estimate, I
an
guess.
estimate. Yeah, and I would say like, how many have I supported in delivery? Because a lot of people, confuse a doula with a midwife,
Yeah.
and like, so the midwife is going to be that one that's actually like catching the
Kids the
baby,
baby, yeah.
delivering it.
Okay, okay.
Think of the doula as, I'm going to be like supporting the mom, giving that
Yeah.
emotional, physical support, advocating for her. But I started in summer of 2020, as I mentioned. So since then, I'm probably thinking 20 to 30 people that
Oh,
I've
that's huge.
served. And yeah, it's
Wow.
something that I do part time. So
Yeah, no, I mean, that's awesome. I mean, and my wife is a huge fan of Erica Badu, and like, she does her doula thing for the celebrities and all
yep.
that stuff, and she's lighting incense and all that stuff. Do you light incense and candles and play soft music and all that stuff?
It really depends on what the mother wants. I'm gonna make the atmosphere warm and inviting for her.
Okay,
I
okay,
do have like some battery operated candles that sometime will help dim the room, make it a little bit more comfortable. Not incense. I don't even think some hospitals would allow it. If it's a
right, that's
home birth,
true.
of course we could do that. We could do our
Yeah,
thing if that's their preference. Sometimes I will take like a little aromatherapy, and have some like oils going,
nice.
like peppermint stuff like that.
Yeah, so I mean, so like take me through like start to finish of a day in the life of a doula.
Yeah. So I'll start with like, how we interact with our clients. Clients will reach out to us. We will do a consult with them because, we want to get to know them. We want them to
Yeah,
get to know us. We may not be the doula for everyone. And as a doula, we're going to be in your very personal, intimate space.
absolutely,
So we need to make sure that, you feel comfortable with us. We feel comfortable with you because, it's a very special, intimate time.
absolutely.
For sure. So I start, meeting with the families before birth. We develop a birth plan. The birth plan
Nice.
will kind of outline all of your wishes that you want to your providers or anyone who may be interacting with you at the hospital to know. We even outline, what ifs. What if, there's a need of an emergency cesarean? Then this is what I want. We have all this lined out ahead of time. I give my clients evidence-based information so they can make their own decision on, the choices that they
Absolutely.
want to make. But they're knowing this beforehand, before they get into the moment. It's not, oh my gosh, I'm in the moment. You're throwing this information at me. What do I do now?
Yeah.
I'm making sure, that they're educated, they're aware of all this information before going into the birth, so it can make that process smoother too. We practice different comfort measures, ways to kind of alleviate some of the labor pains, ways that they can labor at home a little bit
Okay.
before heading to the hospital if they're
Yeah.
birthing at the
Yeah.
hospital. And then when it's at time for the actual birth, I meet them at the hospital or wherever they're birthing, and I'm by their side continuously. I provide support for them, and even their partner. I'm making sure that their partners with them, that they are being, supported as well.
Yeah.
Sometimes partner needs breaks. I'm like, if you need to go home, let the dog out or something, I'm
Yeah.
here. If you want to be more involved, here, grab this or, massage your shoulder, do this,
Yeah.
stuff like that.
Okay.
So that whole time. And then when it comes to the postpartum part of it, my doula partner, Dominique, does majority of the postpartum, but we meet them at home. We help them with light chores around the house, getting adjusted. A lot of our clients are
That's
first
dope.
time parents, doing light laundry, meal prepping, helping moms with breastfeeding support and stuff like that.
That's dope.
And postpartum care is so important because a lot of
Very,
times people
very.
will come over, visit, they want to hold the baby, oh, this and this. But who's holding the mom? Who is
The
supporting
mom
the
is hurting.
mom?
Yeah, the mom hurting.
Who's
Yeah.
supporting the mom? So definitely as a doula, we are the ones that are supporting the mom along the way.
So I got so I got two questions. I mean, so you said, you got like this like elaborate birth plan.
Yeah.
What is the percentage of these birth plans that actually go to plan?
That's a good question. That's a good question. And we definitely go into this with our clients, letting them know that these are more your birth
Yeah,
wishes.
yeah,
These are
absolutely.
and absolutely in the event of, situations where it's an emergency or something that we need to change plans, they're open to that. And even sometimes I've had clients that are like, I don't want any medication. I'm going to go in, I'm going to labor on my own. But, sometimes you get in and you've been laboring for a while, those contractions are coming quicker and harder and faster, and in the moment you want to change your decision and you want to get some
I
medication.
didn't
That's
need
fine.
that man.
That's fine. That's absolutely fine. That's
Absolutely.
absolutely fine. You can change your mind at any time.
Absolutely. So, as I'm thinking, right? So we talking about the, like the healthcare system. So, is a doula something that health insurance covers, or is something that clients pay out of pocket?
That's a good question too. So in Michigan, Medicaid now covers
Oh,
doulas.
good.
Yep. Private insurances don't directly cover. Like we, as doulas, can bill directly to Medicaid and be paid.
Okay.
Private insurances are not there yet, but some of them will reimburse clients. Like we've had clients that have paid through like their flex spending card, or
Yeah.
who have maybe submitted the receipt that they've paid cash to us directly to their
Absolutely.
insurance to
Absolutely.
seek reimbursement later. Sometimes they require a letter of medical necessity from a provider. And we say, if you're Black, it's a letter of medical necessity. You need a doula.
Gotta have. I mean, I'm even thinking now, like, even though I'm done, I'm done
Yeah.
having. Well, I didn't have kids. Shout out to my wife. She had both of our
Mhm.
beautiful kids. But um, like we probably could have benefited from a doula. Like,
Yeah.
even thinking about little Layla, like when she was born, my wife did most of the laboring at home.
Yeah.
And I mean, we were in the smack dab middle of a pandemic. This was July of 2020. People were just starting to kind of come outside just a little
Yep.
bit. Um, but like when I say we got to the hospital and my wife was already like 8 centimeters,
Oh
nine
yeah.
centimeters dilated
Oh yeah. But she.
already. So she was almost ready to
Yeah.
go. Right.
Yeah.
So, yeah, we get there. Mind you, I've been probably up since 4 a.m.
Mhm.
Because I had to work that day.
Yeah.
She called me during lunch, like, "Yeah, I'm having some contractions and all that," and then they continued all day. They got closer and closer, and so we end up taking my son to his daycare provider's house, which we were friends with. So stay with them, and then we got to the hospital. I rested for I don't know, probably 5 minutes. I
Mhm.
kick my feet up, trying to get me a nap
Right.
because I'm like, this is gonna be a long one, right?
Yeah.
And no later than maybe 5-10 minutes after they just checked her in the triage and all that, and I went back. They were like, Mr. Southern, it's time to go. Now they packed up all her stuff. This is her story, like from like the other side. Yeah, they said, all right, don't panic. Like we, it's time to go. Like, and they grabbed all her stuff, packed it
Mhm.
up, put it on a cart, wheeled her down, came and got me. I had the luggage, and I'm just like, oh, it's time to go.
Yeah.
So, um, literally maybe an hour or two, maybe hour and a half. Layla was here,
Yeah. Yeah.
because this was like 10. Yeah, it was like 10:30 or something like that. So, I would say 2 hours because she was born at like 12:30.
Yeah.
So,
That's great. And that's like the perfect, like, situation scenario when you are able to labor at home for that long. I
yeah,
always tell my clients to labor at home for as long as they can, before you get, to the hospital. You're more
yeah.
comfortable at home, less, poking, prodding people, always checking on you and stuff like that. So that's great.
But yeah, like, just going back to like my story earlier, right? Like
Hmm.
she wanted to labor at home because of her horrible
Yeah.
first
Hmm.
experience, with my son, right? So she's like, I'm not going to hospital. And it was a pandemic.
Yeah.
So she's like, I'm not going. And my wife, she's very,
Yeah.
straightforward.
Yeah.
So she's like, I'm not doing it. Like I'm just
Hmm.
gonna, and it took me to say, what, them contractions kind of close. Like I think we should be going,
Yeah. Yeah.
And she's kind of like, it's hitting her, but she's kind of like, taking them like a champ, like,
Yeah.
and I'm like, nah, I think it's time to go.
Yeah.
So yeah, we packed up everything, and like I said, a couple hours later, Layla's here. you know,
You
and
wasn't trying to have to deliver Layla at home yourself, huh?
I mean,
No.
we got a nice big soaker tub, you know, with the jacuzzi jets and all this and that, where we could have probably delivered at
Yeah,
home.
yeah.
Um, but I'm kind of glad we did because like thinking about how Layla came out, I'll never forget it. She came out with her arm up on her face,
Oh, yeah.
so it kind of nicked my wife a little bit, and she had to
Yeah,
get some stitches and stuff. But
yeah.
so I am glad that
Yeah.
we went to the hospital because I don't have I don't know how to stitch up anything.
Right,
I
right.
don't have no local anesthesia or anything
Yeah,
like that. So,
yeah.
but yeah, so yeah, so we talked about that. Um, so now we're gonna break off into some some little fun segments real quick.
Alright.
The first one is, which we can kind of see it, but when I edit this, might not be able to see your shoes. This segment is called "What do you got on your feet there?" So yeah, so we're gonna talk about what we got on our feet. I'm gonna move my mic just for a second here, so I can get my shoe off. All right, so I wore these for you.
What?
Um,
Okay.
yeah. So everything I got on is to support all the mothers, the baby girls that are born, and then my pants represent the baby boys, the blue, all that good stuff. I got both, a girl and a boy. But also this is to represent my birth year. So this is a flight 89. I was born in 89.
Okay.
April of 89, and these are flight 89. I only bring them out every now and then. Um, I got these when I was working for the Nike factory, outlet factory in Birch Run. Um, and they were like 20, $30, but they were special to me because they were my birth year.
Yeah, yeah.
So we're talking about doula, we're talking about, healthcare and helping everybody, I came out in 89, and when I look at like my baby picture from the hospital, we used to get these shirts from what is now Covenant Hospital, but it used to be called Saginaw General. And it would say, I got my first hug at Saginaw General,
Oh.
so 1989, I wore these, and then, they're blue,
Yeah.
for the baby boys,
Okay.
so absolutely. So yeah, let's talk about what you got on your feet.
Alright, alright. You want me to take mine off too?
You don't really have to. I mean, you can just kick them up. You can kick them up. You don't have to take them off.
Alright. I, have on some Reeboks, I don't there's no story behind them. I just like the bright color, someone told me I needed to, have some more bright colors in my
Absolutely
life,
fresh though.
so,
Those are
they're
fresh.
comfy, and
Yeah.
I'm all about comfort now, so
You know what? In my ripe age, I am, 34, be 35 this year. And I choose comfort over like style any day.
Yeah,
Because I want to be comfortable. I'm walking all the time. I'm on my feet. I'm doing things. I'm driving the kids. I'm, here at the studio. I'm outside in the yard or whatever, right? And I want to be comfortable.
yeah,
So I'm choosing comfort. I'm starting to get to that age where comfort is king, but you can still have comfort and style.
that's true.
So my dad is infamous for wearing dad shoes. The Nike Air Monarchs, for all my sneakerheads out there that who insanely started like wearing these dad shoes and like putting different shoestrings in them, different colorways. Like they like are really rocking the Nike Air Monarchs. And there was like some kind of signature line that came out at one
Oh,
point. I'm
wow.
just like, why? Like my dad, my dad literally like at one point had probably I would say I would say six pair of the same pair of shoes, like where he would cut grass in these, he would do something in that, he would go to church in these, and he would, this is his dress up pair, with like his jeans. So like he would have the same pair, but they were comfortable to him. So
Yeah.
I'm starting to understand that, but like I said, still can have style.
Yeah.
I have a lot of different shoes, from dress shoes to um, sneakers, and I got boots. I don't wear Tims because they aren't comfortable.
They aren't, they aren't.
Um, they do look good
Right.
with like jeans and things like that.
Yep.
Um, but I've now graduated to Doc Martens, which off camera I have my Doc Martens sitting right over there. Those are very comfortable boots. So I wear those. But I am a sneaker guy. I enjoy sneakers. That's my vice. Some people, they got cars. Some people, they got, the Indian Remy wigs and all that stuff. I think they call them bust downs now. Like the bust down wigs. You know what I'm talking about? Where they spending $1,000 on,
Yeah.
um, not for me. Or my wife. And my wife has long hair. She got locks, but
Yeah.
like, yeah, that's not for me. But shoes are. And shoes are one of those things that go on sale sometimes,
That's true. Yep.
I don't think bust downs are going on sale anytime soon.
Nah. Nah, no.
So I enjoy shoes because you can kind of express yourself in that. Like I might have on all black, but then I might have on, something like that, right? I might have
Mhm.
on a different colorway that just makes things pop, boom.
Yep.
And then I think it's a cultural thing,
Yeah, absolutely.
growing up in Saginaw and any, hood USA, it was like you probably would get talked about if you didn't have on, some like fresh kicks. Sorry to the kids that got bullied. I do understand that you just couldn't afford them, but your parents got you shoes to put on your feet. So be thankful, and hopefully you worked hard enough. Now you can get your own shoes.
Yeah.
But yeah, shoes are my thing. What about you? Shoes? Are you
No, I'm actually super frugal, like, on most everything, but I love to travel. That's the one thing that I won't have no
That's
budget
your
on.
vice though.
That
That's your
is,
vice. Yeah,
yes.
yeah. I mean, but that's it, right? I'm
Yep.
frugal on a lot of other things. Like like I had to follow what God told me to do, right? To like open the studio, but I did not. Like I was kind of like, nah, I need to keep this money in my pocket. You know
Mhm.
what I mean?
Yep.
But obviously it's been fruitful and all that good stuff. But like, um, I enjoy vacation too,
Mhm.
which I'm glad you said that, right? Because that's my next segment.
Okay.
It's called Top Five, and for you, your top five because I did know that you travel because like you're gone all the time. I'm like, dang man, where's Sharde at? Man, she ain't in church today. Like, but what are your top five either visited places or vacation spots? And so
Okay.
for me, I haven't been out the country, but I do have places that I love to visit all the time. But do you want to start or I'll start?
I can kick it off.
Okay.
Top 5 places either traveled or favorites. I would say I'm gonna start with number 1, then I'll work down. My number 1 would be Hawaii. I really loved Hawaii.
Ooh, okay. Okay.
Um, Number 2, Greece. It's beautiful.
Always wanted to go to Greece.
All the pictures you
Yeah.
see of
Yeah.
Greece, that's exactly how it is, but everything's at the top of the hill.
That's what I
You
hear.
gotta climb. The elevation is horrible. Their path stones are like cobblestones. Don't try to wear heels. If you got any accessibility issues with walking or anything, it may not be.
So do you need Jesus sandals over there or?
Oh yeah, yes, with some grip and
There's a grill.
yeah,
Yeah. Yeah.
you might
Yeah.
even need like some
Like some hiking,
hiking.
yeah,
Yeah,
hiking sandals or
because
something. Yeah.
yes, everything is at elevation. Yeah, and even I have asthma, so it was a little
Yeah.
tough for me adjusting to the elevation, but
Absolutely.
beautiful. All the pictures you see, that's exactly how it
Was it
looks.
like humid? Was it humid over there?
I went in August. That's the hottest month. I don't recommend. Don't go in
Okay.
August unless you
Yeah.
ready
Yeah.
for.
Okay. 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 Yeah.
That's the hottest month there. Don't go in August.
Yeah.
um,
Greece. Yeah. Okay. So Greece number two.
yeah. I honestly I just love the beach. So like for me, like I can always just go to like Miami or anywhere in Florida just
Absolutely.
for a getaway, quick getaway, especially in the winter.
Absolutely.
I'm always just going to Florida for a quick getaway. So I'd say Florida for number 3. Um Honestly, all of mine might be beaches. I was gonna say like Cancun
Yeah.
for number 4. A nice just chilling resort, all inclusive, everything taken care of. Okay, and now I'm gonna try to do one that's not beachy. 5. Let me see. I just would say Chicago. It's a quick
See,
yeah.
that's why we vibe. That's why we vibe. You know what I'm saying? All right, so mine. I wrote mine this morning. When I woke up at like 5 this morning, but because I was like, okay, this is what I know she likes to travel, so this is gonna be the top 5. So, my top 5 places visited, vacation, whatever. Number 1 is the U.S. Virgin Islands. So, I am a beach guy too, where I can literally sit there on the beach, not do anything, and just look at the water,
Yep,
and I'm at home.
me too.
I'm
Same.
at peace. Yeah, like, it's just something about just looking at the water, the warm, the sand between your toes, whatever.
Yeah.
Maybe got a lawn chair, maybe got a little blanket or towel or something down there. But just to be out there, you smell and you see like the birds flying around. Like, it's just, so the Virgin Islands, I actually went snorkeling there and all that stuff too. And I can't even swim.
Yeah.
Yeah. And I like got in the ocean.
Yeah, that
I
that's
overcame fear. So faith over fear.
yes.
I
Yeah.
didn't think I was gonna drown. I had on the vest. I had my flippers on, and all that good stuff. But got in the ocean, did a little snorkeling, but I came back, pretty fast because I was, I was kind of like Peter, out there on the water.
Yeah, yep, yep.
I was walking. Well, I wasn't walking. I was, swimming, but
Yep.
but I was like, oh man, I'm out here in the ocean.
Yeah.
This is crazy.
Yep.
Then I kind of started to freak out a little bit, and then I
Oh,
was like,
yeah.
you know what? Let's get back on this boat.
Yep.
So, U.S. Virgin Islands. And really is not just LA. But I've only been to LA, but I heard San Diego is phenomenal. But California is one of my favorite places to go too. Um, we were just there for Christmas, so like you just said, like quick little getaways, to somewhere warm because Michigan is terrible in the winter.
Right, right.
Um, California, and then I might as well throw Vegas in there, like as a kind of like a two-parter to number two. Because we went to Vegas and Cali at the same time.
Yeah.
We just drove to Cali and then came back to Vegas. So,
Oh, yeah.
I Miami,
Yeah.
is great.
Mhm.
Um, my first dose of Miami was I think my freshman year at Boston College. We were playing down there, and I'm just
Okay.
like, oh, okay. It's a blizzard in Boston right now, and
Mhm.
it's 75, 80 degrees down here.
Yep.
Um, People are on the beach, they're walking around
Mhm.
with pretty much nothing on. And this is great.
Yeah. Yeah.
So
Yeah.
um next is Chicago.
Okay.
Chicago is by far one of the best cities. And I think, and this is just me, I love seeing cities with a lot of black people that are thriving and doing their thing.
Absolutely.
Um, and that's why number 5 for me is Atlanta. Um, like people talk about the traffic. I'm not there long enough to even worry
Right.
about the traffic,
Yeah.
right? But I just love going. I went down to Atlanta um for the first time in '96.
Yep.
And that was when we had the Olympics down in Atlanta.
Oh, yeah. Okay.
So that was my first dose of it. And I see all these black
Yeah.
people
Yeah.
that aren't just your stereotypical drug dealers and just either you're like hooping or you're like chasing girl. Like
Yeah.
I saw doctors,
Yeah.
lawyers, people in tech.
Yep.
um I saw just people walking around that like you can tell they had like some money and they
Absolutely.
were trying to do better for themselves.
Absolutely.
And that was my first time just kind of like, wow, they're not working at GM. No shade to nobody that work at GM because I worked at GM too. But yeah, it was just like, wow,
Yeah.
I can do this too.
Yeah.
So I
Yeah.
wanted to, I wanted to do um better for myself, as I was growing up. So I always tried to get good grades and, just stay focused.
Yeah. Absolutely.
So
Yep.
those are my 5, but I mean I got honorable mentions in there that, you know,
Yeah.
I mean, there are places
Yeah.
that still I love. I love Houston.
Yep.
I even like DC.
Yeah. I should have added
DC
DC.
is
Yeah.
actually a great place to go.
Yeah. I definitely should have added DC.
Chocolate City, you know what I mean?
Yeah.
And shout out to all my folks over there in DC and
Yeah.
Maryland area, Baltimore, but yeah. So we're gonna like start to wrap it up, right? So along with where you're going, like where you see yourself 5, 10 years, um, I just added this segment with my last episode, but what are some risks, some calculated risks? I want to say that calculated risks. Just don't be taking any kind of risk.
Right, right.
Take some calculated risks, right?
Yeah.
But what are some calculated risks that's going to get you to where you want to go in the next 5, 10, or shoot, couple weeks, month, that you can let the viewers know that, hey, like you can do this too, but just like some calculated risk because this is the Risky Lifestyle Podcast, and you know, um, sometimes you got to take a risk, and out of those risks are rewards sometimes,
Yeah, absolutely.
So yeah,
Yeah, that's a good question.
loaded,
It's
loaded question,
it is a
but
loaded question. Yeah, I think, well, I think it was just a risk stepping out into like the entrepreneurial space, which you probably, can attest to. I think I never saw myself as like an entrepreneur. I never was like, oh, I want to, have a small business, do this. But when I figured out that I could turn something that I was passionate about into, a business, I'm like, okay, this is the way to do it.
absolutely,
But at the same time, you know, help the community and do stuff that is helping others.
absolutely,
So I mean, it was a risk. It's a lot of stuff with like starting a business that you don't think about, you don't know about
absolutely
behind
not.
the scenes. It's definitely a risk. I think a lot of people, always talk about ideals that they have, or, they might even, take some opportunities to be trained in certain things.
Yeah,
But then it's like, okay, where do I go from here? And it's like, you gotta just go and do it, and,
yeah, it's a
a lot of
risk.
the things that you need, in order to grow, you have to have a business for. A lot of the funds and, grants and stuff like that that you need, you gotta have that business for, so you gotta just step out and start that sometimes.
Yeah, I mean, it's a huge risk, but I'm sure you can attest to it. But because, like for me, like I really, really plunged out into the deep, like taking a buyout from my former company, GM, and really just diving into entrepreneurship.
Yeah,
So like for me, like it's really scary, like at times where it was a huge risk, but like it's freedom though. Like, no one is telling me what to do.
yeah,
Like, I get to
yeah,
do what I want,
yeah,
when I want, how I wanna do it,
yeah,
structure it how I wanna structure it. And I took some great things from, the companies that I worked for, in the past, and tried to implement some of those things here, at Risky Studios, downtown East Lansing. But it's so freeing being able to, make my own schedule and do different things and come up and be creative with how we're gonna possibly bring in more strings of income. What like other services are we gonna offer? Like how can we partner with them? How can we partner with them? Right? It's a lot of freedom in that, and I would say um, so far so good.
yeah,
So far so good. So
yeah.
but yeah, like, so let me ask you this last question before we wrap it up. Do you see like you owning like your own firm of doulas, and just like managing them, or will you still like have your like bootstrapped up and feet on the ground? Like we got this
Mhm.
Sharde Burton's school of doulas, or this firm of doulas, right?
Yeah,
Like,
yeah.
do you see yourself doing that at some point in the future?
I don't know. That would definitely be something that would be stepping out and taking a risk on. And I kind of think, I don't necessarily know if I will always be on the ground, with my bootstraps doing the work as a doula as much because, it does take a lot. You're on call a lot, stuff like that. And, like sometimes as a single person, like I have more time, obviously, but
Absolutely,
when I get ready to settle down and have a family and stuff, I'm gonna have to shift priorities in my
for sure,
life.
for
And
sure.
so, Yeah, thinking about other aspects, or other ways to make a difference, and that could be an option for sure.
Yeah, I mean, because then, like, at that point, you're not on call, but you're still overseeing everything, right?
Yeah,
We and like entrepreneurship, there's ownership, right? So
yeah,
now you own this thing. You still got this stream coming in, but you're just calling the shots. You're like, hey, make sure they're doing this, make sure they're doing that,
yeah.
you know. And I'm gonna get back to, this beach, and I'm gonna,
Yeah,
what I mean? Like
yeah,
I'm gonna
yeah,
just relax a little bit, I put in the work early, so now I can reap some of the benefits, right?
yeah.
So yeah, any last words that you wanna, give to our viewers, you can look right in that camera and just say, hey, you know, XYZ.
I just am encouraged to always spread the word about, what a doula is. So many people don't know what a doula is, that they can even have access to a doula. I encourage people to check out, not only us, but other doulas that might be in the community and doing, great work as well too. We are hosting our second annual community baby shower coming up on April 6th. So we are in the community a lot, getting to know people, making sure people know what a doula is, spreading the word about that. Ingham County Health Department is actually doing a Black doula training coming up. So if
Wow.
you are a Black woman interested in becoming a doula, there is an opportunity and there's a great need here in Ingham County. So
So yeah, tap in with Miss, no, sorry, not Miss, Doctor Sharde Burton on anything that that pertains to doula or healthcare or whatever. She's available here in the community of Lansing. Do you got any socials that you want to give out? I mean, you don't have to, because I know sometimes, socials can get a little weird, but
yeah, no, absolutely. Follow us at North Star Birthing Services on Instagram and Facebook. Those are our socials. NorthStarDoulas.com.
let's go. Let's go. So yeah, huh? This has been another episode of the Risky Lifestyle Podcast. And hey, like, share, subscribe. And listen, if this has blessed you, share it with somebody else. That's all I ask. But yeah, continue to watch. And we appreciate all the viewers and listeners. And yes, I'm Joshua Southern along with Dr. Sharde Burton. And yeah, this has been a Risky Lifestyle Podcast. Peace. Blessings.